if you have low back pain, if you have herniated disc or protruded disc, or if you have numbness or pain in your hip and in your legs, what we call sciatica, you're going to love using the pain therapy system because it's very effective for treating those conditions. Now, first thing you do, let me turn around here, is you put the two big pads on both sides of your back like this, okay? And then you just turn it on. Let me turn it on first. And then you just turn it up to a point where you actually feel the muscle is contracting and relaxing. And you're going to feel many different types of stimulation, okay? With our device, every few seconds, you actually get a different type of treatment. And that's why it's very effective. Your body never get used to it because it's always constantly changing, all right? So you're going to feel a deep, soothing massage deep inside your back, and that feels really nice. Now, ideally, okay, you should be sitting down, relaxing while you're getting back treatment. But however, if you must use it while you're standing or walking, you can. This is a portable device, runs on 2 little batteries, so you can take it anywhere, okay? So, but in the ideal situation, okay, you should be sitting down. So let me sit down and show you. Now, you can use this while sitting, driving your car, or while you're working in front of your computer, or just while you're watching television, all right? So that's the best. Let your back relax, put your feet flat on the ground, don't cross your legs, and just feel that deep, soothing relaxation. And you can feel the circulation actually improving and going on as you're getting the treatment. And do it for at least 20 minutes, but if you have more time, do it longer. Frequency-wise, 3 to 5 times a day until you feel you reach a maximum, recovery. And then after that, you can just, use it as you need. Now, if you do have hip pain or numbness running down your leg, I'm going to show you how to treat that, okay? That's relating to a pinched nerve or herniated disc. So we're going to treat that more frequently and in the right position. So let me stand up. Now, let me turn the machine off. So to treat sciatica, okay, we need one pad right in the buttock, all right? Because this is where what we call the piriformis muscle is, and that big nerve, that big sciatic nerve exits from the hip and runs down your leg. So I'm going to take one pad. So if you have pain or numbness in this side of the hip or your legs, then I'm going to keep one pad on the lower back on the same side. Then I put the other pad right over the sciatic nerve, which is right in the buttock area, okay? For the man, that's where you put your wallet, okay? Right there, right? So you want to stimulate that. So you just, again, sitting down, turn it on, and turn on until you feel a nice, deep, and also fairly strong stimulation. And you can actually feel the circulation running down your leg. Now, for those of you who have diabetes, if you have diabetic neuropathy, meaning you get numbness, you get pain down your leg, or sometimes you just feel this what we call restless leg syndrome. You in the middle of the night, you just can't sleep because all this weird sensation in your legs and it's very uncomfortable. Or you can use it in the same area, lower back and the hip area. This is very, very powerful, very effective treatment in these 2 locations. Make sure you do this 2 area. Yeah. Now, if your pain and numbness goes all the way down, your leg, if after treating this area alone doesn't get rid of that, in addition to doing this, you can, add the following treatment. So after 20 minutes, this area, if you're still feeling some discomfort, I leave the pad on the buttock, and I take the second pad, and I put it to wherever my problem is. So if my pain and numbness goes to the back of my knees, that's where I'll put the pad. If your pain and numbness go down to your ankle, then I put it right down, to the bottom of the calf. Because what I'm trying to do, I'm trying to stimulate and restore normal circulation. So if you have any circulation problem in your legs, from a disc problem, from tight hip muscles, from diabetic neuropathy, or if you had a stroke, you can do exactly the same treatment because we are going to stimulate the nerve and muscle to restore their function the best we can, okay? So use this regularly and you'll see a big difference. All right. Now let me show you a series of exercises for your back, mostly to improve your movement, flexibility, and some strengthening as well, okay? Most important is to have full movement. So the simple thing to do is just rotate your spine this way. Now lead with your head So I'm turning my head first to look behind me. And notice my arms. They're very nice and loose to help me swing loosely. And my back, I keep it loose so it can be stretched. So I suggest doing about 20 of them. Okay, and I also suggest you do them first thing in the morning and again before going to bed. This is a very simple exercise you can do at work as well. We sit in front of the computer for a long period of time. Just get up every once in a while to just move and lubricate the back. Okay, now, next one. I'm going to raise my hand and I'm going to hold my hand together and take a look at my waist here. I'm stretching the whole side of my body, and I do the other side. You should be feeling stretching on the side of your body. Okay, and again, repeat about 10 times, all right? Now, next one, I'll put my hands together and just put that over my head, and I'm going to extend my back, okay? I make my spine very straight and going up, and then I'm going to rotate. Okay, that should give you some idea. Again, you do about 10 each time. Now, next one I'm going to do, I'm going to be reaching my toes. Okay, so let me bend forward. What I'm going to do is reach the opposite toe. So just going like that. Again, I lead with my head. So I look up to the ceiling as I reach down. So I get my whole spine to rotate. And I can adjust the stretching by adjusting the width of my stand. Okay? Look up to the ceiling and bring your hand way back. Good. Now, another thing I do, just going to be reaching to the ground. So I reach forward. I reach right below me and then behind me. Okay, so 1, 2, 3. 1, 2, 3. 1, 2, 3. Now, if you can't go all the way, don't worry, okay? But you should be keeping your legs fairly straight. So 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay? Now next thing, I'll reach to the side. So 1, 2, 3. And the other side. 1, 2, 3. So let me turn so you can see better. Okay? So 1, 2, 3. 1, 2, 3. Okay? Good. Now when you get up, you should bend your knees and then get up this way. Then your head won't feel lightheaded. Let me show you. So anytime you're bending down, don't get up right away. Bend your knee forward and then get up this way. That way you won't get lightheaded. All right. Now other stretches have to be done on the floor. So let me go down to the floor and show you. A simple one is we cross our legs this way. Then using the arm as an anchor, I'm going to be pushing my arm this way. So I'm going to push against my leg. And the other hand, I gently push. And the idea here is to rotate your lower back. So I can feel the stretching going on in my lower back right now. See? That feels good. Hold for a few seconds. Release. Do the other side. So cross the leg first. Cross the arm. Anchor against the leg. Push with this hand. And feel the stretch. Let the back go loose. And just feel the stretching. Feels good. And release. So side to side. Stretching, release. Stretching, release. Okay? Again, you can repeat 10 times on each side. Now, I'm going to turn here, show you another stretch. Now this one, I want you to pull your knee towards the opposite shoulder. So pull the right knee to the left shoulder. So using my left hand, I'm going to pull my knee up and then across. And notice I'm keeping my shoulders flat on the ground. So my shoulder blades are touching. I'm just pulling my knee up and across. So pull up and across. Keep the shoulder blades down and feel the stretching, a light stretch in the hip and lower back. Okay? This you can do in bed. Okay? It's just a very gentle stretch just to get you going in the morning. Good. Now next stretch, I'm going to bring both knees to my chest. I'm going to just gently pump it up so that I can lift the base of my back off the ground. See? Just like that. So pull it up towards your chest. Notice my head and my shoulders stays on the ground. If I do this, I'd be straining my neck, and that's not good. So keep your head down and just pull. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? So feel a nice stretch in the base here. Okay. Now while you're in this position, you can do some sit-ups to strengthen your abs and your back muscle. Now, if you have back problems, you should do what I call rocking chair sit-ups, because that will not put any strain on your neck and will not put any strain on your lower back. So what you do is keep your back curved like the bottom of a rocking chair, and then rock yourself up like this. Okay, so the first step, let me explain. You bring your knee to your chest first, and then you rock up. Okay, so knee to chest first, and then rock up, just like that. See? So 1, 2, 3, 4, 5. Okay? So that's a common way. Now, if you're not strong enough to do it that way, then you can use your hand to give you some momentum to help you get up easier. So again, knee to chest first, but this time I'm going to use my hand to help me get up easier. Okay, so, and you see my back? I keep it nice and curved, just like the bottom of a rocking chair. Okay? Okay, so again, breathe out. So 1, 2, 3, 4, 5. Okay, so that's good for strengthening your abs and your lower back. Now, I'm going to go show you the next stretch. Next one, you have to lie face down. Now, for this stretch, we want to extend the back slightly. So if you have back pain, and if you're doing this one, if it does cause you more back pain, then don't do it, or do less. Okay, you have to kind of feel it, see if this one is good for you or not. So you can do it very gently. Just go up on your elbow, okay, and slightly and slowly lift your head up while extending your spine. And you should feel the lower back being stretched. Okay, once you feel that release, you can now go on your hand and just gently push up. Now, extend the back. And you can just gently rock it to loosen up further. And tilt your head back and just relax. feel the back being relaxed and being stretched. And just hold it for about 10 seconds. That's all you need. And then just relax. And just repeat that 2 or 3 times, and that should be adequate. All right. Now, for the next exercise, okay, this one's a little bit more difficult. This one's specifically to stretch the, what we call the gluteus and piriformis muscle of the hip. This one's very important for anyone who gets numbness or pain in the legs or for chronic back problem, okay, because we're going to stretch the back muscle as well as the hip muscle. Okay, so get into this position, and the leg you want to stretch goes underneath you. Okay, so I bend the knee on my left hip, that's what I want to stretch. I put underneath me, and then I'm going to bring my chest straight down. Now, I'm going to keep the opposite shoulder, this time it's my left shoulder, up, and my right shoulder down, so I can feel the pressure and the stretch on my left hip. That's a really good and strong stretch. Okay, just hold that position for about 10 seconds. And then switch side. So this time, I'm going to stretch my right hip and lower back. So I bring my right leg underneath me. My contact surface is on the outside of my leg. So it goes straight down. And then I put the opposite shoulder down towards the floor while keeping the shoulder on the same side up. So you can really feel it. Okay. Now let me just change position so you can see it better from a different angle. So if I want to stretch my right hip, I would bend my right leg and put underneath me. Okay. I go straight down. I put the opposite shoulder, which is my left shoulder, down while holding the right one up. And feel the stretch in this whole buttock, hip, and back area. Okay. To stretch the left side, I bring the left leg underneath me. I bring my chest down, and I bring the opposite shoulder, which is my right shoulder, down. That gives you a really nice stretch in this whole area here. Okay? So that's a really good stretch for anyone with hip pain, sciatic nerve pain, and low back pain. Now, for the next exercise, very simple. We're going to reach and touch the opposite toe. So, just sitting down, keeping your legs fairly straight, and then just reach forward. Now, if you can't touch your toes, it's okay. Just go as far as you can. It's the motion, and eventually, you'll be able to reach further and further. The key is to do it every day, and then you'll see better improvement over time. Okay, just like that. And then another simple stretch, just sit like that, leg in a V shape. Just hold your leg with your hand, use that as leverage, and just gently pull. So you feel it stretching. Okay, just pull your chest towards the ground. Just like that. Okay, again, those all help with different angles and different muscle groups of your back. Another one you can do is just bring your feet together, hold your feet, and just gently, okay, relax the adductor or the inner hip muscles. The goal here is to stretch and loosen up all the muscle around your hip and your lower back, because if you have good movement, your joints will move better, your muscle will stay more loose, and that's how you stay healthy. Now, one other one you can do is stretch the hip muscle. Just bring the knee like this and bring it towards you. See? Just bend the hip and pull it towards you. Like that. Turn over to the other side. See? Just like that. Okay. So those are some of the basic stretching exercises for your back. And if you do them regularly, it's going to help you a lot. I do suggest that you use my decompression belt, my muscle therapy system, and some of the other supplementation that we have to help you regain your health and to stay healthy. Good luck with your health and best wishes to you. Now I want to show you another optional item that we offer for people with chronic back pain. If you're the type of person that gets back pain all the time, okay, it happens when you're out walking, happens when you're driving, happens when you're flying, okay, happens when you're doing anything, then this is a very good item for you. It's my all-day back pain relief belt, okay. It's designed to use with your pain therapy system. And it's very simple. You just plug it in, you turn it on. It's got built-in electrodes, okay? So you get stimulation and it stays on you. It gives you some support, okay? And it gives you stimulation anytime you need. So you just set it and you can set the timer, 10, 20, or 40 minutes, put it in your pocket. You can go about doing everyday things without worrying that your back may be giving you trouble. Okay, and then, after the treatment, you can turn it off. And then every once in a while, say if you're out doing gardening, okay, you're working for an hour, then all of a sudden, oh, my back's getting sore, tired. Well, before it gets really bad and go into spasm and give you a lot of pain, all you do is turn the machine on, okay? You can keep on doing what you're doing, and the pain will start to go because the muscle get relaxed, the circulation comes back, and then everything's fine. Or if you're driving a long trip, again, have this on every once in a while. Hit that on button, and then you're going to be nice and relaxed, and keeps you out of pain. Okay. So if you have chronic back pain, you should look into this all-day back pain relief belt because it can give you relief anytime you need. Now, I'm just going to open it up and let you see the inside. Okay. Now you may have different versions out there, but they all function basically the same way. This belt has built-in electrodes. Okay. So it's got these electrodes and really, really good electrodes, and they are reusable. You can reuse them, over 100 times, and you need to replace them. You can always just, go on our website and find out how you can get additional ones. And it's very easy. Now, when you don't want to use electrodes, you can just put the cover on. It'll protect that, and you can wear this thing as a regular support belt as well. So that's an additional benefit of this belt. You can use it as a regular belt. You flip the cover over, okay, and then you plug the wire in, and then now you have pain therapy system for all-day therapy. So it's a beautiful device. You should try it. Now, if you have back pain, if you have a disc problem, like a herniated disc or protruded disc, or if you have a nerve problem, a sciatic nerve problem that's causing pain in your hip, in your legs, also numbness, problem with sensation and circulation in your legs, then you should be using the pain therapy together with the decompression belt. All right, you can read up more on our website. Now, the decompression belt helps to support your back, but more importantly, it also has a second function. It actually helps to traction your back. It helps to stretch your back, to stretch the muscles deep inside, so it gets its normal length, and it takes pressure off your disc. Allow the disc to absorb moisture so the disc can expand because it creates this vacuum inside your disc. And because of that, your nerve will not be pinched, and then you have less pain. Okay, so this is very important. So the pain therapy, I recommend you use it first for about 20 to 30 minutes to relax the muscle, to reduce the pain. And then right afterwards, you put the decompression belt on to help stretch your back, to help to restore normal back muscle and dysfunction. All right. Now this is very easy to use. You just basically, it comes with a hand pump. We're just going to put together the air valves. So I screw the air valves together. And then I'm going to turn around here. I'll show you what happens. When I pump this up, okay, the belt actually rises against my back. You see? Every time I pump, it gets higher and higher. And what it does, it actually lifts my upper body weight off my lower back, taking the pressure off. Also, because it offers a very strong support, it acts like a barrel. It helps to support the core and improve my posture. You actually get lifted up a little bit and you stand taller. But more importantly, with time, 20, 30 minutes, okay, the inside your back start to do this. It start to expand vertically. All the pressure coming off your back, it just feels so good. If you have circulation problem in your legs, or if you have a chronic back problem, or your back always feels tense, this is something you should be using together with your pain therapy system. Try it, and you're gonna see incredible results. Now, if you have shoulder pain from tendonitis, bursitis, or arthritis, you should be doing this treatment. Use the large FlexTone pads in 2 areas to start with. We'll put one in front and then one in the back of the shoulder. All right? And we just turn it on. And it doesn't really matter which mode you use. I personally like mode A and B, the best for this area. And the key here is you want the arm to be fully relaxed. In fact, when you're treating any body parts, you should be fully relaxed in a neutral position. You don't want to fight against the machine, all right? You want it to be nice and relaxed so the pain therapy stimulation can help to work the knots out, to reduce the inflammation, to stimulate circulation, okay? You can only do that if you're nice and relaxed. So I usually like to get a cushion and rest my arm like this so that the shoulder can be totally relaxed when I'm doing this treatment. Now, you see the muscle moving, and that feels really nice, okay? It feels like the knot inside is getting worked out. If any pain inside, it's gonna help to, reduce the pain, improve the circulation, reduce the inflammation, and more importantly, help to break up any scar tissue that you may have developed. So some of you may have trouble, raising your arm, like what we call frozen shoulder problems. Then you gotta do this to break up the scar tissue.